All right, so let's go to the next one. Respiratory alkalosis. All right, this is for some reason the CO2 is decreased in the blood. All right, good example of this is someone who's got hysteria, someone who's hyperventilating. You're blowing off a lot of CO2. Does that make sense? Someone who's hysteria. Okay? When you blow, and these are other ones too, which I don't want to go into, but basically pregnancy, high altitude, because there's a decrease of PO2, hyperthyroidism, and if you have an increase of acetylsalicylic acid, but on a different means. So it's kind of, you can see where it gets really confusing when you deal with this aspirin thing, because it can cause metabolic acidosis, but it can cause respiratory alkalosis because it will actually cause the respiratory center to cause hyperventilation. So again, you can see when you get into these other classes, these will get more complicated. I'm trying to keep it short and simple and sweet for you guys. And I think hysteria is a pretty easy one for you to actually manage. So what happens here is that this person is blowing off a lot of CO2. You're blowing it off. So when you blow off all this CO2, your reactions, because there's a little bit, there's only 30% here because you blew it all off, and 70% over here. Does that make sense? You're blowing off all that CO2 faster than you can make it over here. Does that make sense? Can you visualize this? So therefore, they always have more of this. But what's going to happen is, as this diminishes, the reaction is going to keep on going that way to fill it up. Which means that the amount of hydrogen is going down. So what, if the lungs are doing this, the lungs are getting rid of all the CO2. That's why we call it respiratory alkalosis. That's the cause of it, is respiratory reasons. That if the lungs are doing this, then what organs are going to compensate? The kidneys. And what is it going to do? The kidneys are going to try and bring back hydrogens into the system by not making hydrogens get secreted into your urine. It's going to help reabsorb the hydrogens or decrease the hydrogens. Decrease hydrogen secretion or increase hydrogen reabsorption. Somehow we got to get the hydrogens back in there to fill it up. So the kidneys are going to try to compensate this. So, hysteria. You're increasing your respiratory function, meaning you're hyperventilating. When you hyperventilate, you're going to blow off quite a bit of CO2, making the CO2 in your blood less, going down. So therefore, we're going to make this go down because it's going in that direction. Does that make sense? So the kidneys are going to compensate. It's going to decrease hydrogen secretion to make sure it stays in the blood. And it's going to decrease bicarb reabsorption. So it's trying to just bring up the hydrogens over here. Don't want to touch this as much. Does that make sense? So that this goes up so that we can actually get the hydrogens up to make that pH go down. Okay, we're clear with this so far? is the theory about why someone who's hysteric, they blow into a paper bag. Now think about, you've heard of that, right? Blow into a bag, and you blow into a bag. What's the rationale? What's going on with that? Right. You're blowing off a lot of CO2, so now the CO2 stays in the bag, theoretically, stays in the bag, and then when you inhale, you're going to inhale that CO2 that you just blew out to put it back into your system so that we can replenish it back up. Does it work? I don't think it does. I think it's more about someone who's hysteric and when they're focused more on their breathing than what's causing them to become hysteric. Does that make sense? I think it's more of a psychological thing. If there's some sort of theory about this that works, I think it's just minimal. I haven't seen any studies that actually say that that's the reason, that makes them feel better. I think it's more because they're, you say, okay, control on your breathing, keep your eyes closed and control. I think what there is it's a psychological cause of making the hysteria go away. Does that make sense? But the theory about it is that you're breathing in the CO2 to replenish that you just blew off. Okay? Metabolic alkalosis. So this is increasing bicarb by some other means other than respiratory reasons. Vomiting is a good example of this, because we talked about that. I just talked about Tums, antacids. You're increasing bicarb in your body with Tums. Diuretics will do this too. Again, I'm not going to go into that, but it's putting it all together. But think about this. When you're vomiting, you're not just upchucking cookies, right? But also acid, hydrochloric acid. So therefore, you are losing hydrogens out of your body, making your body more alkalotic. Does that make sense? Even though it's just a stomach, you got to look at the whole body. You're getting less hydrogens there. If you have less hydrogens, so if you have less hydrogen, because that's what you're vomiting out, we haven't touched this one. So net-wise, you're going to have more bicarb, are you not, in your body? Because we just threw out some of this hydrogen. So therefore, this is increased up. So think about this. If we're decreasing hydrogens here, how can we fill this? In other words, this is now 30%, and this is 70%. How can we put hydrogens back here? Does the reaction want to go that way, or does it want to go this way? It goes this way. So we don't want to blow off all this CO2. We want to keep it in our system, make the reaction go this way, so that we can create more hydrogen ions. So the lungs are the organs that are going to control the CO2. So what do you think you're going to do to keep the CO2 in your bloodstream? Are you going to breathe very fast, hyperventilate? Or are you going to hypoventilate? Hypo. Does that make sense? And then this will increase. So, what happens here in vomiting, you're going to decrease the amount of hydrochloric acid in your body, hydrogens. Which means you will have, as a net, you will have more bicarb than there is hydrogens. Because we're releasing all those hydrogens. So, what's going to happen here is that the lungs will compensate. You're going to have hypoventilation. You're going to decrease the amount of carbon dioxide coming out of your body to stay in the body so that the reaction can go this way. Check the next time, and hopefully it won't happen soon, but check the next time that you vomit or someone else vomits. And see what they do after they vomit. See what their body, their breathing's like. Now, granted, after you vomit, you get all composed and like, oh my God, it's like, so of course, they're hysteric a little bit. Like, oh, I can't believe it. But when it's all calmed down, give it a few minutes, and then when they go back to the room, or you go back to the room and you're lying on the bed, notice how the breathing is. It isn't breathing fast. It's breathing slow. It's something that the body just does automatically and that the child or yourself don't realize it. It's an adaptive thing that it does so that you can retain that carbon dioxide to try and put the hydrogen back into your body. You'll be breathing slow. You see it. Okay? Questions about that? So you can do this on your own. What happens with vomiting, and you lose the gastric hydrochloric acid. You can see what happens over here. Okay? Because of the metabolic alkalosis. Now let's think about it. Here's case number 5 in this PowerPoint. John's taking narcotics for pain. Okay? The narcotics have depressed his breathing rate. They affect the diaphragm, and you don't breathe as fast as usual. So if you don't breathe fast as usual, what happens to the blood pH? So are you hypoventilating or hyperventilating? Hypoventilating. When you hypoventilate, that means normally you blow this all out, but now you're not blowing it out as well. What happens to the amount of carbon dioxide in your body? Increase or decrease? Increase. You're going to increase the CO2, which again, you'll have 70% of products here, and net-wise, you'll have 30% over here. Which way is the reaction going to go? That way, right? So you have this balance. If that happens, what happens to the amount of hydrogen? Increase or decrease? Increase. So what happens to a person who's taken an overdose of narcotics? What happens to his pH in his blood? Increase or decrease? Decrease. Would that be respiratory acidosis or metabolic acidosis? Respiratory, because what's making this reaction go is his breathing. Does that make sense? His breathing is changing this, is changing the amount of CO2. So the pH will decrease because he'll retain an excess amount of carbon dioxide, which will increase the amount of acid in the blood. The reaction is going to go that way. Is that clear? We got to fix that. What do you think one of the things we're going to do with narcotics? First thing, we're going to pump out the stomach, whatever pills in the stomach. All right, we'll get that out. What do you think we can add if you're going to build up you're going to build up hydrogen here? I mean, the kidneys are going to try to compensate, but we can infuse something else that could also speed this up too. What do you think we're going to add into his IV? Bicarb in the IV, so that this, compared to that, will come down. You see what I'm saying? I think that way. All right? Now these are just summary slides, and then I'm finished with this. Okay? So if you think about it, when you do these kind of issues, questions on the review questions, what would be the indications of acidosis and alkalosis in terms of changes in the pH or the partial pressure of carbon dioxide, or the pH and bicarb? How does that change things? How would the body try to compensate for acidosis and alkalosis? kidneys, and lungs. They're the major organs that are controlling and regulating acid-base. Again, for acidosis, an accumulation of carbon dioxide in terms of respiratory acidosis. These are reasons that would happen. Put them together. You'll be able to figure these out. Metabolic acidosis is anything that's going to accumulate acids that are non-respiratory or an excessive loss of bases. They're giving you some examples on here. And remember, for acidosis, your nervous system gets depressed, slows down. You go into a coma and you die from this. Alkalosis, when we have respiratory alkalosis, something in the lungs is going to cause this. Hysteria is a good example of that. And you're going to hyperventilate and blow up all that CO2, thus making your hydrogens low because it's going to need to fill in that carbon dioxide. And then you have metabolic alkalosis, and it's a loss of acids that would do that, right? That are non-respiratory as a reason. If you have alkalosis, any form of alkalosis, your nervous system tends to be more excited, which can lead to convulsions, and convulsions lead to death. All right? You could do this on your own, showing all this, metabolic acidosis. The CA stands for carbonic anhydrase. That's the enzyme that's here that makes this go on. Okay? I only did the basics for you. But when you get into these other ones, and especially if you're going to respiratory therapy, you'll find out it gets much more complicated than this. Where you can have metabolic acidosis and you can have at the same time respiratory alkalosis. And you're going to have to define what it is. Is it metabolic acidosis with compensatory respiratory alkalosis? It gets much more detailed. And that's why I put X's over here. All right? It's too complicated for this. We need like about at least 3 weeks to go through all the details. This is kind of a nice summary. Again, the Henderson-Hasselbalch equation, you don't have to know it, just the concept of what it is. That if there's an increase of bicarb, then the PCO2 must increase also, right? That 1-to-1 ratio. And this is a flow chart from one of my other teacher colleagues when he taught his class in New Jersey. And he gave me permission to put this in here. But it gives you an idea. If the pH is low, then it's acidosis. Then you go look at the PCO2 and the bicarb. And it gives you a nice flow chart of what's going on here.